34 million. But of that 34 million, 10 million has already been expended since January 2021 to December 2023. We are now left with 24 million that should be expended as of December 2025. That COVID-19 response mechanism covers key things, and basically it's meant to support laboratory system strengthening. We know that there's no health system if we do not have a diagnostic system that supports and gives us information as to what exactly is happening to us. So this fund is supporting improvement of our laboratory system in Liberia. It's also supporting procurement, construction, and solarization of 4 additional regional oxygen plants in Liberia to support oxygen needs during health emergency. We saw that with COVID-19, there was a huge need for oxygen, and it is out of that need that this investment was made to Liberia. These plants are located in Lofa, Nyuma, Grangide, and Greenwood. Additionally, the COVID-19 investment fund is also supporting waste management and building 2 regional incinerators to support healthcare waste across the country. As you all can remember, there was a time in Grambassa where healthcare waste sat for almost a year. So this shows that we have a huge need to support healthcare waste across the country. Additionally, the C19 investment is also going to support integrated sample transportation across the 15 counties with priority on the 3 diseases, HIV, TB, and other infectious diseases. And global fund is global fund of the people, is global fund of the country, is global fund that is huge on country ownership. And with that, there is a part of it that we call co-financing commitment. In Liberia, we say, when somebody washing your back, you should wash your front. So with that, with the commitment, the co-financing enrichment calls for 15% of the grant allocation for that cycle to be committed by the government through its national budget. This means that the health sector is going to ensure that 15% of the investment across the 2 investment streams covers the 3 years period, and this co-financing doesn't cover salaries as co-financing. So it means we need tangible investment in the health sector that comes from the government to also buttress the efforts of the funds across the country. And so far, one of the gains that we have with the co-financing arrangement was that before the previous leadership left, there was a co-financing letter that was signed by the previous administration and identified the 15% that was proposed by government to spend during the 3 years period of the grant. We believe that the government is committed to ensuring cultural ownership and leadership, and that is why today we have His Excellency President Joseph Nyuma Boakai here with us, giving the highest level of support, and we as citizens of this country highly appreciate the commitment of the government to ensure this. Thank you, and God bless us.
Thank you, Ms. Kelko. We'll now have special statements. First, with the Country Director of Plan International, Ms. Mariam Murray, or Proxy.
Sorry, with the media, she's not out. She's out of the country, and she's talking to represent her. His Excellency Joseph Nyuma Boakai, President of the Republic of Liberia, the Minister of Finance and Development Planning, the Minister of Health, Dr. Louis Boto, and other senior officials of the Ministry of Health. The Executive Force Head Africa Big East Department Global Fund, the US Ambassador candidate to Liberia, Ambassador Catherine Rodriguez, the UN President Coordinator to Liberia, and Steve Edward to the other distinguished ambassadors and their Liberia group, the chairperson of the Liberia Coordinating Legality is George G. Group, the chairperson of the National Health Commission, Dr. Cecilia Musa, members of One UN Family, civil society partners here present, members of the South Estate here present, all other protocol observers. Today is a really a fascinating day for the global Black international family. I therefore bring your warm felicitation from our global, regional, world, and national organizations of Black overseas. We are happy that the system integrated HLC, FCCH, and Liberia have been honored today by His Excellency the President of Liberia. We trust the Ministry of the Health and the Government of Liberia in welcoming this Executive Force Head Africa and Big East Department Global Fund team to Liberia who have come to be part of these special occasions. Black International Liberia is indeed excited to have been selected by the Liberian Coordinating Mechanism NCL to be a principal recipient partner to the Ministry of the Health in the implementation of the TC7 plans. Our responsibility will be to serve as the principal recipient of the TC7 HLTP integrated trends with the second wave of the COVID-19 grant as well as major some recipient for the malaria trends. Be the peer for the TC7 HLTP grant and C19 funding. Black International starts with working with the National Health Control Program and other stakeholders to improve access to HIV preventions, care and treatment services, particularly among key and vulnerable populations. Plan will also work closely with the National Leprosy and TB Control Program to improve TB case identification and treatment outcomes in the country. In addition to that, with support to the COVID-19 funding, Black International will work with the MOA to ensure that the health system in Liberia is strengthened, resilience is sustained. This will be achieved through improving the overall supply chain management system for medicine and other health commodities, marketing and diagnosis network optimizations, improving disease surveillance and pandemic preparedness as well, and improving the landscape for the sustainable access to medical system, improving monitoring and information system, building capacity of the community health care workers. In carrying out care implementation activities, Black International really recognizes the important national mandate of the Ministry of Health. Thus, it is our desire to maintain a sustained working relationship with the ministry and its different entities, programs, and partners involved in the DCC grant implementations. The agreement for this was signed and successfully implement the gender equality in time and effectively account for the resources. The GC7 adopts a comprehensive implementation approach for HIV/TB, especially health system in Liberia. Therefore, working with and through the Ministry of Health and other civil society, so recipients, to present a truly unique implementation experience. And also working with the health finance team and the NOH, we pledge to provide all the needed financial updates required for the regular tracking of the disbursement and expenditures to the Ministry of Health and Finance for reporting purposes, while at the same time advocating the government to address the gap in funding to ensure that the current co-financing commitments are met. As these nations plan international, we will ensure that no one gets left behind in the implementation of the national public health disease program. In this work, in cooperating, I want to thank you all, and I wish us all a successful GC7 implementation in Liberia.
Thank you. So Plan International is one of two designated principal recipients of the Global Fund grant. That means they're responsible for implementation of the grant's activities. The second implementing is Catholic Relief Services. When I have remarks from the country representative of the CRS,
Your Excellency, Honorable President Boakai, please permit me to stand on existing protocols. My name is Abina Medome, and this morning it is my pleasure to represent Catholic Relief Services. CRS as an organization has been entrusted by the Liberian people through the Liberia Coordinating Mechanism and the Global Fund to serve as a principal recipient for GC7 malaria and partner very closely with the Ministry of Health, Plan International, civil society, and collaborate closely with other health actors in Liberia to advance the overall goal of reduction of malaria incidence and death by at least 80% come the end of 2027. Specifically, between July 2024 and June 2027, the project aims to serve all Liberians in all 15 counties, focusing on children, undefined, and pregnant women. CRS as an organization is deeply honored to have this opportunity to continue to serve the Liberian people. With a presence in the country since 1957, we have steadfastly partnered with the government of Liberia to address both development and humanitarian priorities. In the health sector, CRS was a key ally during the fight against Ebola virus outbreak. And more recently, in the fight against COVID, we have been close partners with the government. In the last 18 months under NFM3, the malaria grant, CRS has achieved a nationwide outreach, ensuring that malaria testing, treatment, and availability of medication to all required services in the counties across the country. In 2023 alone, we served over 1.5 million people with malaria services in public and private facilities. Since February of this year, we have brought in over 3 million insecticide-treated bed nets into the country for ongoing bed net campaign, which is expected to reach every household across the country. In line with this funding mechanism that was submitted by Liberia for this GC7 grant, there will be an investment on high-value and large-scale activities, such as mass mosquito nets campaign, We are also committed to ensuring that the health workers that are delivering the services to the population are equipped, trained, and benefit from supportive supervision. We are fully aware of the priority that this current administration places on strengthening the supply chain to ensure timely and last-mile delivery of all health products, and our significant and private investment as an organization aligns very closely with this, and it is our priority to better ensure that the outcomes of health in Liberia for all Liberians is achieved. Allow me to publicly reiterate CRS's vision and commitment to local leadership. We are firmly invested as an organization in furthering through partnership backed by excellence and efficiency. While we are the principal recipient for GC7, it is our shared interest that this role eventually is transferred back to the government of Liberia in the future, in the interest of the Liberian people. That is a commitment that we have made as an agency to ensure that local leadership is seen in all of our activities in Liberia. Today, Your Excellency, Honorable Minister of Health, Global Fund Delegation, and all our collaborators, I am honored on behalf of my organization to participate in this launching ceremony. CRS Liberia promises compliance, a commitment to learning, and adaptive management, and above all else, collaboration, as we strive together to meet our goal in reducing the infections of malaria and mortality in Liberia. Thank you very much for your kind attention.
Thank you. Now please welcome Ms. Kathleen Paul-Saw, Head of the Africa and Middle East Department of the Global Fund.
Your Excellency Joseph Nyuma Boakai, President of Liberia, allow me to stand on the already stated protocol while recognizing the honorables and excellencies at the high table, but also civil society actors and communities. We are who we are because of the communities of Liberia. Distinguished guests, all protocol observed. My team often says, where we see you is because there are bad news. But today, I'm not here because of bad news, but to celebrate with you. So I would like the energy in the room to be up a little bit. I would like to express my heartfelt thanks for the warm welcome to Liberia. We are delighted to be in Monrovia for the launch of the Global Fund grants worth $93 million United States dollars. A combined HIV and tuberculosis grant, as you have heard just now from our colleagues from PLAN, totaling $45 million United States dollars, but also a malaria grant amounting to $48 million US dollars, as stated by our colleagues from CRS. Your Excellency, allow me to take this opportunity to share our sincere appreciation for the leadership and the renewed commitment of the government of Liberia in the fight against these diseases and in building resilient systems for health. I would like to particularly recognize the Ministry of Health Engagement under the leadership of Honorable Dr. Louise Mabeko. Let me also reiterate our profound gratitude to the Global Fund donors, whose continued support makes it possible for us to be here today to sign these grants. Our last replenishment showed their unwavering commitment with a record pledge of $15.7 billion United States dollars. In addition to $5 billion United States dollars to fight COVID and mitigate its impact on programs for HIV, tuberculosis, and malaria, which has allowed us to quickly react to a very big pandemic, including in Liberia. To the Liberia Country Coordinating Mechanism, principal recipients, bilateral and multilateral partners, civil society actors, private sector, and all in Morovia, but also in the various counties that we finance. We are encouraged by your dedication, and we are encouraged by the support that you have provided to ensure the implementation of country health programs, but also global fund grants. These do not come without challenges, but success, as you have demonstrated, is possible. Distinguished guests, global health remains a priority amidst an increasingly fragile global economic context. Conflicts that are arising on various continents, competing urgencies like climate change. And we need to focus on moving strides in global health, but also in health in Liberia. The Global Fund, therefore, stands strong with Liberia and will continue to support the government's ambition to fight the 3 diseases and build resilient and sustainable systems for health, in addition to preparing for potential pandemics. During the last grant cycle, despite some hurdles, Liberia has achieved important results. And I would like to highlight a few of them, though Madam Kilipo actually has already alluded to several of them. The first one is the reduced new HIV infections by 50%. And also a reduction in AIDS-related deaths by 67% since 2010. And I think we shouldn't underappreciate that, because these numbers matter. They're about people. They're about men that you know, women that you know, and children that you know. The percentage of people living with HIV who know their status has also increased to 74%. And the provision of antiretroviral treatment also has more than doubled in 5 years. For tuberculosis, which is the disease in my heart, the incidence has remained stable since 2015. And the overall number of TB-related deaths has seen a reduction between 2015 and 2022. But we are facing a potential rebound, and we need to refocus. Malaria has seen a 60% reduction in incidence rate and a 33% drop in mortality rate. And it's important to also mention that Liberia is moving towards digitalization, and the first ever digitalized campaign is actually currently ongoing. I wouldn't be true to myself if I didn't also highlight the essential work of community health workers in the response to the 3 diseases. And the government commitments to recognize the critical role that they play, but also the critical role of community health worker supervisors as part of the formal health architecture. This is a win. Your Excellency, much has been achieved in the past few years, but much more is yet to be implemented. If we truly want to make a difference in the lives of people of Liberia, we will have to jointly work together, believe that we have all the same objectives, which is that man, that woman, and that children in the various counties that you're from. The grants that we're signing today will be executed, as you heard, by Catholic Relief Services and Plan International. And we have vested in them a lot of confidence. You've heard both directors or acting directors committing themselves to working very closely with the Ministry of Health, and we will hold them to account for that. The subrecipient civil society organizations and communities will also have a significant role to play to ensure that those who need the services the most are the ones that are reached. The grants aim to contribute to Liberia's ambitious public health priorities and to reach the Sustainable Development Goals by 2030. I will not go through them. I also believe that they were covered. But maybe just to say that in addition to these grants, the investments that will be complemented by the COVID-19 repurpose funds for use by December 2025 will help further enhance laboratory systems and networks, human resources for health, community system strengthening, digitalization, surveillance, and oxygen infrastructure. In an era where resources are becoming more and more constrained, complementarity, integration, sustainability should guide the execution of finance activities. This means ensuring that the responses to the 3 diseases is truly anchored to primary healthcare platforms. It also means strengthening key pillars to impact so that we can deliver quality services, improve access to diagnostics and testing for all Liberians, with no one left behind, improve data visibility up to the last mile of their key life-saving commodities in a timely manner, but also foster the overall governance that is surrounding the implementation of grants. Actors from all levels will have the arduous task to pursue optimization, value for money, and accountability, so implementation is efficient and followed by results and impact. We collectively owe this to the people of Liberia. Everyone in this room owes this to the people of Liberia. So we commit to a continued and robust collaboration with the Ministry of Health and other government entities, the principal recipients, and all partners so greater health outcomes are attained. The Global Fund's financing to Liberia, as my predecessors have alluded to, is complementary to the government's investments in health. And we appreciate the continued efforts to meet co-financing requirements in order to deliver on the national health objectives. The power of partnership through coordinated activities among development partners will also be key to greater impact and saving lives. Your Excellency, now my call is to you. I call on you to continue championing health as part of your developmental agenda and to sustain investments in health from domestic resources. Whether we are in the room with you or outside the room, I call on you to be the champion for health. And we stand next to you in your endeavor to have the health ecosystem also think, love, and build Liberia. We also stand next to you to build a better and brighter Liberia for your people. Let us leverage all opportunities for sustainable health investments in Liberia and hold ourselves accountable to effective delivery, results. And as we sign, launch, and celebrate past accomplishments, let us also reflect and draw the lessons learned from the last grant implementation that will allow us to move with resolve to deliver health services to the people of Liberia. And Liberia's achievements in the fight against the 3 diseases, but also in building resilient and sustainable systems for health, will then feed into a compelling narrative for donors during the next replenishment in 2025. Your Excellency, distinguished guests, we look forward to celebrating with you the successful response to these 3 diseases with domestic financing, funding from donors, funding from the private sector. We need to start tapping at their door, and these grants in June 2027. I wish the women and men of the land of the love for liberty remarkable success, and I thank you.
Will not call for Catherine Rodriguez, U.S. Justice Affairs, to make remarks.
Good morning, everyone. His Excellency Joseph Nyuma Boakai, President of the Republic of Liberia, ministers, excellencies, ambassadors, heads of mission, donor partners in the health sector, including the United States, all protocols have been observed. It is an honor to join you today in celebrating a significant milestone in Liberia's journey towards a healthier future, the launch of the Global Fund Grant Cycle 7. On behalf of the United States, I extend our heartfelt congratulations to the government of Liberia, the Global Fund, and our development partners for this additional grant to continue our partnership in the fight against HIV/AIDS, TB, and malaria. Our shared commitment to these challenges remains critical to the lives of all Liberians. The United States, as the largest contributor to the fund, is proud to be part of the program's success and is grateful for your partnership. Like you, our commitment to global health is unwavering, and working together is the best approach to ensuring success. Our shared investment is yielding tangible results. Just to cite one example, in 2022, Liberia's malaria indicator survey shows a significant decline in malaria prevalence among children under 5, dropping from 45% in 2016 to only 18% in 2022. I commend the government of Liberia for being an effective partner in the fight against malaria, TB, and HIV/AIDS. Just as we share a commitment to supporting public health, we must also work together to ensure that every dollar provided by the Global Fund is accounted for and goes to the intended recipients, the people of Liberia. Talking about accountability is easy, but living up to that standard every day is something most countries, including the United States, struggle to do. However, I am confident the government will do its due diligence and put in place measures to ensure legitimate expenditures, diligent oversight, and timely, transparent reporting. Let's make this a grant model on how to do things right. Beyond reproach, a symbol of excellence of the remarkable work you all are doing and deserve. I want to thank the Boakai administration and the legislature for their efforts to increase the budget for the health sector. All Liberians benefit from a healthier society and not just a physical and psychological wellness. Investing in health is key to fostering economic prosperity. A strong public health system is a basic condition for a strong workforce. I urge all stakeholders, the legislature, the executive, and civil society to play their part in the effective implementation of these grants. Congratulations to the government of Liberia, the Liberian Coordinating Mechanism, and to the Ministry of Health for making this grant signing event a reality. As President Boakai has said, let's continue this journey with renewed vigor and determination to think Liberia, love Liberia, build Liberia. Thank you.
Thank you, Catherine. Just to quickly note, the United States remains the largest contributor to the Global Fund. That since its inception 2002. So we will now call on the civil society representative to the LCM, represented by Evans Ade.
Good morning, everyone. Your Excellency, Ambassador Joseph Nyuma Boakai, President of the Republic of Liberia, kindly allow me to stand on the existing protocol to make these remarks on behalf of the civil society groups within the LCM. As civil society organization, we are very grateful to be here today to witness this historic signing ceremony of the official launch of the Global Fund GC7 grant, which we see as a step further to achieving the important activities that we do at the level of the community and as we do collectively as civil society. We also want to re-emphasize the way to achieve our goals as civil society. We need the strong political will of the government of Liberia. And how do that happen? There are policies that drive our implementation. We want to ensure that we have the full support from the government of Liberia, as well as
legislation, it will also need the support of our parliament. Our city senator Vakula is here, and we can assure you that collaboratively, the GC7 implementation library is going to be a success because we're going to employ all necessary innovative strategies to ensure that programs are reaching to those who need them. We must also work collectively with all our different partners because, especially for the HIV and TB brain, we take the multi-sectoral approach to ensure that all persons are available because the three diseases that have been mentioned there, it doesn't pick and choose. It cannot say because you are a rich person or a poor person or because you are in the second year or you are in brain cancer or compartment, malaria can attack anybody. So we should all put our collective effort together to ensure that the investments that have been made to Liberia by the Global Fund is being used accordingly and with the accountability and transparency. Because we as a society will not keep quiet because we also want to ensure that no one will be left behind in the future. Thank you very much.
Thank you, Evan. Is there a proxy from the UNRC's office?
Your Excellency, President of Liberia, Honorable Minister of Health, dear Excellencies, all protocol duly observed. Please allow me to make a statement on behalf of the University of Liberia. Madam Christine, who is now attending the World Corporation Day. The government of the Republic of Liberia, in collaboration with the Global Fund, is working to strengthen the national health products supply chain to provide improved inventory management of pharmaceutical and commodity and ensure pharmaceutical and commodity security and also the availability of all pharmaceutical and commodities throughout the country. Today we want to highlight the invaluable contribution from the Global Fund resources in making to improve the national response to HIV, TB, malaria, and the strengthening of the Liberian health system. If we look at the key achievement, which include the progress on the target for the HIV, the reduction of the malaria prevalence as stated by the US Ambassador, Madam Catherine, the improvement of the programmatic management of MDR-TB, the strengthening the laboratory capacity in this country, but also improving of the supply chain management, particularly to ensure that essential medicine reach the last mile where they are needed and can make maximum impact. And to be fair, if you look at the Global Fund grant for the health commodity distribution, allow me to thank the USAID for the contribution made by USAID on the management of the CMS, because the United Nations through WFP has been implementing the downstream transport, ensuring that health supply chain from this 10 health program move from the central medical store to the 15 counties across the country, targeting around 180 health facilities, including hospitals and community work. But we need to ensure that, like we talk, Honorable Minister of Health, from that the President, the Excellencies, really want to ensure that the medicine reach the population of need. And I know you have that from the bottom of your hearts. And I want to tell you today that WFP, the United Nations, is committed to support you to ensure that all the medicine that we deliver reach the population that we need in the countries. Therefore, the UN country team, through its specialized agency, will collaborate with the Global Fund and the government of Liberia to contribute to the control and the elimination of this targeted disease to meet the SDG target by 2030. Thank you, Excellencies. Thank you, Honorable Minister. Thank you all.
Thank you, Dr. Ali Udang, WFP Country Rep to Liberia. We will now have remarks by Honorable Anthony Myers, Deputy Minister of Fiscal Affairs, Ministry of Finance and Development Planning.
Excellency President, members of the diplomatic corps, members of government, our development partners, and other stakeholders in the health sector. We want to first say thank you for staging this event. It is no doubt that these three diseases know no boundaries, they know no timelines, they don't respect budget cycles, the infection rate do not lapse at the end of the fiscal year. So it is critical that, as the chair of the coordinating mechanism noted, that a funding mechanism, a co-financing mechanism in budgetary term we call a counterpart funding arrangement is in place. So to begin with, we will in due course initiate conversations with the Ministry of Health to see the details of that as we get more information about the nature of the GC7 in terms of what that 15% translates into and how we can go about programming it within the context of our prevailing constraints. And events like this and programs like this give us reason to rethink our budgeting and funding process, because our current annualized budgeting format and long-term budgeting do not lend themselves well to tackling ongoing issues like the fight against TB, HIV, or malaria. So without much ado, we can say that as we also begin the National Development Plan process for the next 5 years, we will also be engaging with the Ministry of Health and other partners in the health sector to ensure that we can have a more programmatic approach to funding the health sector, if not the entire sector or all of the activities in the sector, critical programs such as the one for which we are here today. So, Madam Minister, and Madam Director of the Regional Global Fund Program and the Chair of the LCM, and the President is here, but I'm sure you will agree that I can say on behalf of the government, you will be our partners, as we've always been, despite all of the challenges and constraints. This is something that the Ministry of Finance, working with you and other stakeholders in the sector, we will be a part of. We say thank you very much.
Thank you. At least when we're discussing co-financing commitments, we know where to go. The Minister of Foreign Affairs will now be represented by Honorable Karishma Palamwad, Assistant Minister for International Organizations.
His Excellency President Joseph Nyuma Boakai, President of the Republic of Liberia, advocate for the health and well-being of the Liberian people. Permit me to stand on all existing protocols. I am deeply honored to bring you warm greetings from Her Excellency, Madam Sarah Beslo Yanti, Minister of Foreign Affairs of the Republic of Liberia, who would have loved to be here today, but is catch up with other engagements, and have entrusted me with the privilege of delivering a short remark on this official launch of the Global Fund Grand Cycle 7 for the Liberian people in response to AIDS, TB, malaria, and health system strengthening. Ladies and gentlemen, it is with great pleasure and a sense of profound responsibility that I stand before you today on this momentous occasion, the launching of the Global Fund Grand Cycle of Liberia, in collaboration with the Ministry of Health and our esteemed partners. This initiative marks significant milestone in our ongoing efforts to combat HIV, TB, malaria, and strengthening of our health system across Liberia. The challenges we face in addressing these health issues are formidable, but so too is our collective resolve to overcome them. The Global Fund's support represents not just financial assistance, but a partnership rooted in solidarity and shared commitment to improving the health and well-being of Liberians. Through this grand cycle, we will enhance our capacity to provide essential healthcare services, reach valuable populations, and scope up interventions that have provided effective in combating these diseases. It is our opportunity to innovate, collaborate, and accelerate programs towards our health targets outlined in Liberia's National Strategic Plan. I commit the Ministry of Health and our dedicated partners for these tireless efforts in preparing for this moment. Your commitment and dedication are vital as we navigate the complexities of healthcare delivery in Liberia. As Assistant Minister for International Organization, Ministry of Foreign Affairs, I pledge our continued support to this vital collaboration. We will work tirelessly to ensure effective coordination, transparency, and accountability in the management of these resources together. We will strive for impact and tangible improvement in the lives of those we serve. Let us seize this opportunity with optimism and determination. Let us honor the trust placed in us by the Global Fund and our partners by delivering results that make a lasting difference. Together, we can achieve a healthier, stronger Liberia for all as we think Liberia, love Liberia, and build Liberia. Thank you.
Thank you. I'll now call on Councillor Oswald Twere, Attorney General of the Republic of Liberia and Minister of Justice.
Mr. President, members of the Democratic government ministers here present, and the Minister of Health, officials of government, our partners and friends here present, members of civil society, good morning. Today is indeed a great day for the government of Liberia as we come here with the President to launch the Global Fund Grand Cycle 7. Through this initiative, our government people have been helped a lot in combating HIV, TB, malaria, and helping our strengthen our health system. We are indeed grateful. In this public manner, we want to commend the Ministry of Health, the employees, the health workers, and the fund itself for this great help to our nation. As one of the line ministry within the membership of the LCM, we want to show the Global Fund that we do all as a government to ensure transparency and accountability as we deliver to the people of Liberia. We have to continually stress this point because, as the Charge Affair of the U.S. Embassy said, it's easier said than done. We have to always keep it foremost in our minds so that our people understand that there is a new day. It cannot be business as usual. We have to be accountable and transparent. So we pledge our support. Again, we say thank you, especially the Global Fund, for helping our country and people. Thank you.
Thank you, Minister. It gives me great pleasure to call the Senator of Grand Cape Mount County and the Senate Chair on Health, Senator Daba Babla.
His Excellency President Joseph Nyuma Boakai, Minister of Health, Mr. Soul, our guest and your team, Cabinet Ministers here, development partners, particularly those who work with us in the sector, the Fourth Estate, ladies and gentlemen. It is an honor for me and a pleasing opportunity to participate in the launch of this Cycle 7 of the Global Fund. In April, during the celebration of the World Health Day, we gathered as health actors and made a commitment to reduce the number in maternal and newborn health, many of which are due to the 3 diseases that the grant supports, and also the weakened health systems, especially in rural Liberia. Over 20 years of partnership with Global Fund and the investments made to our health sector, we are very grateful. All of the numbers, the indicators that have been mentioned here, reduction in malaria, reduction in HIV, are all due to our collective efforts. So let me say thank you particularly to the health workers. I am particularly pleased to welcome you, Mrs. Soul, having met you in Geneva, and we sat and had discussions about your last visit here. Thank God today, this visit is a direct opposite of the last one. On behalf of the leadership of the legislature, we want to recommit our support to ensuring that we work with other relevant ministries and agencies. I'm happy that the Minister of Finance is represented here, to ensure that we firstly increase and expand our revenue envelope, and then appropriate significantly to health sector. As Ms. Kellepo mentioned, all of these grants will be coming, but domestic revenue should be appropriated to the needed health sector. and we are committed to doing that. I think the first budget demonstrated an increase, and we look forward to more increase. Mr. Minister of Finance, you just touched the point that I wanted to say. When we met at the legislature, especially the House of Senate, on January 15th, we all recognized the need in the strategic areas, and one of those areas that stood up was the health. If you don't feel the brunt of the weakened health system in the communities, in the counties, we do as the people's representatives. Because we are there with them. When we see a pregnant woman show up and there's no generator to run electricity in the delivery room if there's a clinic in our community. These are things that touch us. And so we made a commitment that we will work with all of us in the appropriation cycle to go back to program-based budgeting, which makes oversight easier, accountability easier. And to the civil society, we are partner in this. We are going to quickly start inviting you to begin our engagement in some of those legislations that we met that have not been finalized, so that we can start a conversation around it. And working with the leadership of the both houses, you can be assured of us working hard alongside you, the Ministry of Health and other health workers, to make sure that those legislations are passed. Having said that, I want to say congratulations to all of us, and want to assure you of the transparency, assure you we think that we'll be accountable for these funds, and we said that with all of our passion, we will do that. Thank you.
Madam Chair, President of the Senate Committee on Health, Madam Minister of Health, members of the Cabinet, other officials of government who are present, members of the diplomatic corps, former officials of government, heads and representatives of international and local non-governmental organizations, our development partners, civil society organizations, members of the press, distinguished ladies and gentlemen. It is my pleasing duty at this time to present to you His Excellency Joseph Nyuma Boakai, President of the Republic of Liberia.
Good afternoon. Please have your seat. I leave here today with two things in mind. We already asked the CFC director to take note of all the commitments that have been made here, to be able to remind them. And the second thing is that everybody who has spoken here except for Kennedy are standing on existing protocols. And nobody had refused when Kennedy speaks our protocols to be duly observed. So we want to say by the Minister of Health that the reason quoted Minister of Health Family, the representative of the NGO community, representative of our partner government, institutions, foreign diplomats near the capital, our hard-working medical professionals, esteemed guests, members of the media, distinguished ladies and gentlemen. It is with immense pride and deep sense of responsibility that I stand before you today to officially launch the Global Fund Grant Cycle 7 in Liberia. This significant occasion marks a new commitment to combating epidemics of HIV, tuberculosis, and malaria, diseases that have for so long plagued our nation and hindered our progress. The government and the people of Liberia remain eternally grateful for all our funding the Global Fund for making their work possible, making lives healthier and longer. The Global Fund has been an invaluable partner to Liberia over the years, supporting our nation's development agenda by contributing tirelessly to our healthcare system, providing crucial support in our fight against these deadly diseases. The GC7 grant is a testament of the Global Fund's unwavering dedication to improving the health outcomes in countries like ours, where the need is great, challenges are many, and opportunities few. This grant will not only consolidate the gains we've made over the years, it will also strengthen and accelerate our national response to HIV, tuberculosis, and malaria. As we embark this new phase of our partnership with the Global Fund, it is crucial to acknowledge the significant strides we made thus far. Through previous grants, we have expanded access to essential health services, increased the availability of life-saving medications, and improved our healthcare infrastructure. Yet, we recognize that much work remains undone. The GC7 grant will enable us to build on these achievements, ensuring that our healthcare system is more resilient, efficient, and accessible to all Liberians. Our commitment to improving healthcare is unwavering. We will continue to prioritize training and capacity building for our healthcare professionals, ensuring that they have the skills, resources needed to provide high-quality healthcare. Moreover, we will invest in strengthening our supply chain management system to ensure that medications and medical supplies reach those who need them most in a timely and efficient manner. The fight against HIV, tuberculosis, and malaria requires a comprehensive and coordinated approach. Through the GC7 grant, we will enhance our prevention, diagnosis, and treatment efforts for these diseases. We will implement and innovate strategies to reach key populations, reduce stigma and discrimination, and promote community engagement and ownership of health initiatives. For HIV, we will focus on scaling up retrovirus
therapy, expanding access to HIV testing, counseling services, particularly to high-risk population groups, and promoting HIV prevention measures such as condom distribution and awareness campaign. We will also prioritize interventions to prevent mother-to-child transmission of HIV, ensuring that every child born in Liberia has the opportunity to grow up healthy and HIV-free. Furthermore, we will improve multi-sectorial coordination and promote sustainability of the HIV response under the oversight of the National AIDS Commission, which I head. In the fight against tuberculosis, we will strengthen our diagnostic capacity, ensuring that all individuals with TB are promptly identified and treated. We will also enhance our efforts to address multi-drug-resistant TB, providing specialized care and support to those affected by this challenging chronic disease. Malaria remains a significant public health challenge in Liberia, particularly for our most vulnerable populations, including pregnant women and young children. Through the GC7 grant, we intensified our efforts to distribute insecticide treatment beds and support our national malaria control program and stakeholders at all levels to ensure timely diagnosis and treatment for malaria cases and ensure timely, complete, and accurate data for decision making. We will also continue to promote community-based interventions, empowering individuals and communities to take an active role in malaria prevention and control. A special focus will be on the reduction of gender and human rights-related barriers to optimal malaria prevention, testing, and treatment services. All grants, HIV, TB, and malaria, will share a common vision of supporting resilient and sustainable systems for health with cross-cutting integrated interventions aligned with government policies and priorities. Areas of our focus will include strengthening our supply and chain system, network of laboratories, community system strengthening, health financing system, monitoring and evaluation system, and health sector planning and governance for integrated people-centered services. While the support from the Global Fund is instrumental in our fight against these diseases, we recognize that sustainable progress requires collective effort to ensure national buy-in ownership. The government of Liberia is fully committed to addressing the gaps in funding and ensuring that our co-financing commitments are met. We will work diligently to mobilize domestic resources, strengthen our financial management systems, and foster partnership with other stakeholders to secure additional funding for our health programs. We understand that the path to achieving our health goals is not without challenges. However, we are resolute in our determination to overcome these obstacles and build a healthier, more prosperous future for all Liberians. Our government will continue to prioritize health as a key pillar of our national development agenda, recognizing that a healthy population is the foundation for sustainable development and economic growth. As we launch this global fund, Grand Cycle 7, I call upon all stakeholders, government agencies, development partners, civil society organizations, and the private sector to join us in this critical and crucial endeavor. Together, we can create a Liberia where no one is left behind, where every individual has access to quality health care, and where we can look forward to a future free from the burden of HIV, tuberculosis, and malaria. In conclusion, I extend my heartfelt gratitude to the Global Fund, its doctors, donors, and all partners who have stood by Liberia in our journey towards better health. Your unwavering support and commitment are making a profound difference in the lives of our people. Let us seize this opportunity to reaffirm our collective commitment to health and work tirelessly towards achieving our shared vision of a healthier, more equitable world. It is in this height that I take some great pride and deep satisfaction to announce that the total approved amount given under the grant for Liberia to accelerate its fight against HIV, tuberculosis, and malaria, and to strengthen our health system. The amount is $117,546,670 United States dollars. €117,546,670 million United States dollars. This substantial investment underscores the international community's confidence in our ability to turn the tide against these diseases and transform our healthcare landscape. And we marvel at the size of this donation and bring towards this set target. Let me remind you that the best way to acknowledge, appreciate, and thank the donors will be judicious, smart, frugal, transparent, and purposeful in the use of their donation. I trust we can and we will do just that. Thank you, Global Fund, as do justice to this noble mission as we think Liberia, love Liberia, and build
Thank you, Your Excellency. The President of the Republic of Liberia has highlighted the Global Fund's contribution to Liberia's health system strengthening, and the government is fully committed to addressing the gaps in funding and ensuring that our core financing commitments are met. Not only will the grant consolidate the gains we've made, it will also strengthen and accelerate our national response to HIV, TB, and malaria. Thank you, Mr. President. We'll now move on to the presentation of the symbolic check and the signing of the Global Fund Grant Cycle 7 by the Honorable Minister of Health, Dr. Louis Mkoto, and Mrs. Kathy Falso, Head of the Africa and Middle East Department of the Global Fund. The signing will be witnessed by His Excellency, the President of the Republic of Liberia.
Sunday.